name is Jade. I'm going to be your nurse today. I have doctor's orders to change your dressing. So I'm first just I'm going to pull the curtain and I'm going to wash my hands over here. Washing our hands. Okay. We got kind of a tight setup over here. So we're going to try to just maneuver around it. Okay. Just going to move it my way. Okay, can you please say your first, last name, and date of birth for me? All right. Do you have any allergies? No allergies? Okay. We medicated you 30 minutes ago with your pain medicine. Are you having any pain right now? No pain? Okay, well, if any point during the procedure, if you do have pain, just let me know and I'll stop and then we can move from there and see if we need to give you some more medicine. I'm just gonna put your bed all the way to my waist. So what we're doing is I'm gonna be taking out your old dressing, taking out the old packing, and then I'm gonna put in new packing, because what we're trying to do is we want that wound to grow. We want the healthy tissue to grow, and so that your wound can heal. Okay, alrighty. So I'm just gonna come over here, set my things up, and then I'll be back over here to change your dressing. Okay, so I'm just gonna I wash my hands. I'm gonna put some clean gloves on, and I'm just gonna this is gonna be more of the sterile part when we're gonna be packing in the dressing, and this is just for me to help me take out the old dressing. So okay, so I am just going to put the red biohazard bag. This is what we're gonna throw away all the things in so I don't have to keep moving around. Okay, and I think, I'm gonna make sure I get my absorbent pad because we want to place this underneath the patient. I'm just gonna move this a little bit over. Okay, I'm gonna just pull this down, and if you could just lift up your leg for me. Just gonna this under, just so that if there is any drainage, it won't get on the bed. And this is a clean sheet, so that'll be good. Alrighty, I'm just going to open up some of these. I'm just gonna open up this. Some of these things have already been pre-opened from practice, so all right, and this is also paper tape we're gonna pretend, because I know you wouldn't use plastic on patient's skin for this part. Just gonna open these in case. Alrighty, so I'm going to take this, you can use alcohol or the adhesive things, and I'm just going to use this to pull it off. And this would be paper tape as well. Try getting this off. Cardboard box is kind of breaking, but that's okay. Just gonna drop that in there. And okay, I'm gonna take this part off. All right, and this is an important step here because this is how we're gonna assess some of the drainage that was on there and through the packing as you look at it. But the patient had minimal drainage. There's no odor, there's no signs of infection. It's a clearish drainage, and it doesn't smell, like I said before. No signs of infection, minimal drainage, like I said before. And this is really important because this is what we're going to see for if there isn't any infections or anything that we should be concerned about, or let the doctor know. So this is important for documentation. So I'm just going to drop it in there. Okay, so now we have our packing in there, and the packing's probably dry. I don't know how long it's been in since the last change. So if we pull it out right now, it's probably gonna cause the patient pain, and we don't wanna do that. So I'm gonna just put some saline over it to help wet it, and to make it, pulling it out, not as hard on the patient, difficult. So I'm just gonna take my saline, and this is not gonna be just sterile inside, but not on the outside. Go from this way. Okay, and then I'm just gonna pour some. There we go. Okay. Alrighty, so I'm just gonna pull it out because I can do that with these gloves, and you can monitor the drainage as well from in there. Pull it out. Okay, so like we can see in this, you can monitor right now the tissue. What does the tissue look like as it's growing in? So for me, I see beefy, red, moist granulation tissue. I don't see any necrotic tissue or slough, the yellowing. I don't see any necrotic tissue, like I said, or dead tissue or eschar. You also want to look around the peri wound. Is there any signs of maceration, signs of infection? We're looking for all those things and making sure that we document it and document the tissue and what it looks like and the characteristics of it, and especially just any signs of infection. And so in reality, there wouldn't be this much drainage. If there was that much drainage, that would be a very big concern. Something's wrong. But this is just because of the cardboard box. And so, yeah, so now our next step right here is we want to measure it. So I'm going to get my things to measure. Okay, so we want to measure lengthwise. And the measurement's not going to be perfect, but okay. The measurement is around 3.1, 3.2. And then this side, oh. Okay. And then, yep, this is also 3 as well. It's a nice 3 by 3. I'm just going to put this here so that I can measure when I go in for the depth. So I'm going to take my, I'm just going to take one of them. None of this is sterile yet, so I'm just going to put it in here. The deepest point looks like it's this side. Okay, and then I can measure it right here. Okay, and this depth is around like 2.8, 2.9, almost 3 as well. So we're just going to throw that away. Take the last one. There's not really any tunneling in mine, but there is undermining, so you're just going to want to do that. If there's tunneling, I'm going to do tunneling as well. Okay. Just hard to maneuver this a little bit. Okay. Okay, and this is around 3 as well. Yep. Okay. So we're just gonna throw that away. And at this point, you want to irrigate it. If you had doctor's orders to irrigate it, you would be doing that. You would be cleaning on the inside from the inner to the outer, cleaning the wound. You want to do 1 inch around the peri wound, cleaning it. And if you have any doctor's orders to put cream or something else on it, you would do that kind of during this time and after the packing. So anything that the doctor ordered. But I'm just going to verbally say that I cleaned it and I cleaned the outer side. I dried it before we started anything else, really. Okay. Let me check. Okay. So now I'm going to take off these gloves and wash my hands. Now I'm going to wash my hands again. And now we're starting with the packing. All right. And actually, I'm gonna put another set of gloves on because I didn't open my other things yet. Okay. So I'm just putting on gloves. It'll go in there. Okay, for this next part. So this was already previously opened from practice, but I'm just gonna open this, making sure I'm not touching the outside. Okay. Can open this. the sterile gloves when I do that. Don't want to cross over anything. Okay. All right, and these are sterile for the purposes of this, and this is opened as well, but we're just going to pretend it's not, and I'm opening it now. So I'm going to be careful with these Q-tips because they can go out. Okay. Just be careful because they like to roll around. Okay, we're still sterile. Making sure you're not crossing over. Okay. And then you just want to open these. Just going to maneuver my way around here. There we go. This way. Just want to be careful because this is all sterile in here. Okay. And this is already, okay. I'm just actually going to shuffle a little so I would open it. This is probably going to be the best way for me to open it. They're limited space. And these have already been pre-opened for practice later, so I have practiced a lot with it. Alrighty, so everything is set up for this. This is sterile. I would open this out of the package that it would come in. Alright, let's see. Okay. Alright, so now it looks like I have everything ready for this. Nope. Very important part. So this would be the sterile saline. I'm just going to use this again for practice, but this would be sterile saline that I would have over here. So when I would open it, I'm just going to drop some over these gauzes because we need to get these nice and moist. Oops, maybe too much on that. I'm just going to put this back here because there's not enough room, but we're not using that again anyway. Okay. Alrighty, now I'm going to take these off and just drop them in there, and I'm going to wash my hands very good. Okay, it's kind of going to be hard to open up these with this space here, but yeah, we're going to try to see where's a good spot. Very limited space here. I'm just going to for the purposes, we're going to pretend that I had put this right over here. So then this gives me a better area to do this. Oops. And that would, there we go. If that were to happen, I would actually probably get another piece of glove, another glove. Very hard with these limited space. Okay. All right. Oh, making sure it's not touching me. These are tiny gloves I have. Ordered the wrong size. Okay. This is always the struggle. There we go. Okay. Making sure I'm not touching anything. You can always adjust it once it's on, so it's sterile now, so I can adjust it. That's a lot better. Okay, and I'm just gonna move that over. We can pick that up later. Okay, and this actually should be a lot more closer to me, to the sterile field. Okay, now I am going to take this. I'm going to squeeze out the excess. We've already cleaned the wound, we've irrigated it, we've done everything, and we've taken a culture. If we do see signs of infection, we have already cultured if we needed to do that, and monitored the progression of the healing and the characteristics, taking notes for documenting. Okay, so you just want to squeeze out that extra fluid and just really stretch this out. Okay. All right. And I brought the scissors because I think I'll probably have to cut it depending on this hole. It's starting to break, so We'll see. Okay, and this is really careful. You don't want to touch anything. So, okay. So we're going to go over here. And the really important thing about packing is that you don't get it on the outside of the wound. So I'm just going to try my best. A little difficult with this setup, but just being careful that you don't get at the outside of the wound, because it can cause just increases the risk for infection, maceration, and all that not good stuff. So we want to be really careful not getting the outside of it. And if you do, you're going to have to start over, because that's not good. But for this, I'm just verbalizing. If it touches the outside, I would start over. Okay. And for this, for the last one, I did have to put another one in there. I could probably put another one. It's supposed to be loosely packed. So I'll just probably put in another one, not that much. It's a little on this side, you can see. So I'm just gonna throw that one out just in case. I'll probably have to cut this as well. Oops. Be very careful it's not splashing everywhere. Big thing is just risk for infection, so making sure that we're being as sterile as we can be. Separating this. It's loose. We want it to be loose. We don't want it to be all bundled up so that the wound can grow. Okay, be careful I'm not splashing. Okay, and then I'm just going to take my sterile gloves. I'm going to cut it because I know it's not going to be able to. I don't want to put that too off the sterile edge, so put that there. Take, oh, in reality I would get a new one because it touched the outer edge. But okay, be careful that we're not touching the outer edge. Okay, oops. I'm gonna make sure it's not touching. See, this might have been a little too, oops. Oh, that's not good. Okay, let's work through it. The wound had gotten a little bit, the box is kind of breaking. So, are you in any pain? Nope. Okay. So that looks nice and packed. Doesn't look too packed, and looks pretty good. Okay. So it's all packed, no pain. You're doing okay? All right. So now I'm gonna keep the sterile gloves on because this is sterile, and we're gonna put this on the outer edge. Like I said, if the doctor had ordered any ointment or something else, we would be putting that, but now it's on there like that. And then we have the ABD pad and the blue to the sky. So, because it's going to tell us like a diaper, if it's going to tell if it's too moist, a lot of drainage. Okay, trying to think. I got everything. All right. And now I'm just going to take off my sterile gloves, or I could just, I mean, it's all sterile now, so, or not sterile, non-sterile, so I'll just, honestly, I should just probably put on a new pair of gloves. Okay. Okay. New pair of gloves. Just gonna move this over. Let me go get a new pair of gloves. Trying to shuffle for the new pair of gloves. Okay. For the purpose of this video, I'm just gonna use these again. I would not do this in real life, but I have no idea where the other gloves went, so malfunctions. Okay. I'm just gonna pretend these are the clean gloves. Probably could have done that with sterile gloves on, but just don't want to get infected. Oops. Okay. Okay. Now I got my clean gloves on. So now I'm just gonna tape it. Okay. And we would use paper tape, but don't know where mine went. Okay, you doing okay? Alright. Just tape it so that it's secure enough. There we go. Can't find the tape. Okay. There we go. Our last tape. Okay. Alrighty, so we got everything in there. Now I can throw away all of this, but I'm just gonna put this in here. Okay, you doing okay? Alright, no pain. Just gonna drop that in there. And then I would put new clean gloves on as well to close this and to throw this away in the proper receptacle. So I'll just pretend that's there. Okay, I'm gonna take the absorbent pad off of you with new clean gloves as well. Okay, I'm just gonna cover that, and oh, you can look at it. And also, if I wanted to put a piece of tape on it to just put my initials, the date, the time that I did it, I would put it right here. And I also just want to document, I would document all the observations that I saw and within like the tissue and the characteristics of it, the drainage, the amount, if there was odor, signs of infection, what I did, if there was any bleeding, what type of dressing I put on. This was a wet to dry dressing, how the patient tolerated the procedure, and yes, I believe that is it. So just making sure proper documentation and ensuring that they had no signs of infection, and if they did, we need to assess further and notify the doctor. And I would throw all of this away after that. And okay, thank you.